Hi, this is Dr. Lori Blondell, and today I'm going to talk to you about pelvic health issues. But the subject matter today is going to be about men's pelvic health, an issue that is rarely talked about. We talk a lot about women and pelvic health issues and bladder leakage and childbirth and what that does to women's pelvic floors, but we don't talk a lot about men. So today I want to get into that subject. Men experience a great deal of pelvic floor, bowel, and bladder issues that are really almost non-existent. Men don't know where to go for help when they have leakage, when they're told they have prostate problems. Doctors a lot of times don't know what to do or even know how to refer them to anyone to help them. There's a lot of pelvic floor specialists, not a lot treat men, or not as many treat men. And today I want to talk to you a little bit about how a pelvic floor specialist can help men and how I can help men in their symptoms just as much as we can help women. So the pelvic floor in men and women is an identical muscular structure, 3 layers that kind of does the same thing. When a prostate is removed, the neuromuscular structures are disrupted, and men have the same lining, the same muscle linings as women do. And men don't know how to reactivate those muscles. So in pelvic floor therapy, you can be taught the same things, how to contract and relax those muscles. You go into surgery if you're told you need to have your prostate removed or you have an enlarged prostate, and that whole urinary system can be disrupted. And part of getting control over your bladder can be going to pelvic floor therapy. There's lots of different ways to treat bladder symptoms in pelvic floor therapy, but you have to be properly diagnosed by a physical therapist, i.e. me. So first, when you come in for an evaluation, I want to go over your symptoms and, what are you having a hard time with? Are you getting up 5, 6 times a night? Anything over 1 time a night is not good. You want to get good sleep. So if you're getting up multiple times a night to go to the bathroom, that's not normal. And there are things that you can do about it. So I'm going to look over your bladder habits. How often are you going? How long are you going? And we're going to work on ways to curtail that number by strengthening your muscles and then properly relaxing them. I'm going to teach you things on bladder irritants, when to go to the bathroom, when to not, how to lift your bladder up, how to relax your bladder. All those things can be taught by just working with your muscles, not adding more pills, pharmaceutical agents, not surgical, and what you can do prior to surgery if you do have to have your prostate removed or partially removed. What you can expect after a prostate surgery, because there's a whole lot going on and no one really tells you what to expect, and sometimes the expectations are really different than the outcomes. But part of a pelvic floor therapist's job is to really educate you on what you can do and what's going to happen after your surgery. And it can be pretty scary to come out and have a whole lot of bladder loss and unknown sexual function and not know what to do. And I really love working with men post-surgical to help ease their discomfort and help them to know ways to improve their quality of life after surgery, and know that there is hope to regain that bladder function, and know that they're working toward improving their sexual function and what you can do. And it's not hopeless. It's not just, well, this happened, so now I'm gonna have all this urinary leakage, and there's a lot you can do.